My dad's story started when he had some chest pain. He felt chest pain and he had a hard time breathing. So we decided, me and my siblings decided to bring him to the hospital because we have no medical background at all. So we don't know what to do with him. And gladly that the doctor said that it was a good thing that we rushed him to the hospital, because if not, something might happen to him.
So this is a 70-year-old male patient, history of high blood pressure. He had a small stroke in the past, but unfortunately this time presented to the hospital with chest pain, difficulty breathing, and they found that he was having a very large heart attack.
Our patient initially presented with a heart attack, which we would call an NSTEMI, and he was found to have, have the classic symptoms of chest pain, shortness of breath. Now, a lot of times patients that are older, they might present with just fatigue and feeling tired and really just not having the same energy levels that they did before.
So Avalon came to us with severe chest pain and was found to have multiple complex medical problems. He had severe complex blockages in his heart arteries, along with an ulcerated plaque or a tear in his artery in his aorta. This is usually handled with surgery, but it's very high risk.
The help of Cleveland Clinic Abu Dhabi as well. It was well explained to us what's going to happen and how the procedure would go and how easy it will be.
And his case initially was thought that maybe we can take a surgical approach for his arteries. However, it was discovered and noted on a chest x-ray that he actually had an abnormality of his aorta. So he did undergo further workup, which included a CT scan of his chest and his aorta, when they discovered that he had a very dilated, what we would call an aneurysm of his aorta, and also was found to have ulcerations, which essentially are signs that he is at risk for this aorta to tear or rupture in the future.
We also noticed that in addition to his large heart attack, he also has what we call aneurysm of the proximal ascending aorta. In simple terms, it is the aorta itself as it turns and go down to the rest of the body. It was very large, more than 6 centimeters in diameter, and there were already ulcers in the area, which are signs that this area is going to rupture.
Cases like this really benefit, for complex cases, we really benefit from a coordination of multiple teams of experts, along with the availability of high complexity and very advanced equipment.
When we met with our vascular surgeon and the heart surgeon and so on, it was clear that this patient is very sick. If we don't do anything, this patient will not make it beyond few days in hospital.
We just don't want to lose my father because he's the only parent left to us.